Hey, Dr. Walley here. Today's video is about floaters, and this is one of the most common things that I hear about every day in practice. At least one person comes in and tells me about these. They sometimes describe them as little black spots that are floating around in their vision. They maybe look like little bugs or gnats. I've had people tell me that they think they look to the side and they're seeing a bug in their vision, or they even look like little cobwebs floating around. And they tend to be more noticeable against a blue sky or a white background. So people say they see them a little bit more if they're driving or if they've been out at the beach. They tend to see them a little bit more then. But the good thing is, most of the time, they're harmless. So, little quick anatomy lesson of your eyes here. So let me show you this picture that I have here, this fancy picture. So this is your eyeball, and about 4/5 of your eye is made of this vitreous jelly. And inside that jelly, you have all these little collagen fibers that hold that jelly together. And over time, as you get a little bit older, that jelly becomes more of a liquid. And as it becomes more of a liquid, those little collagen fibers can break off in there. And that's essentially what you're seeing, is those floaters kind of moving around in your eyes from that jelly kind of breaking down over time. So the number one risk factor of floaters is age. And like I said before, they're typically harmless, but they do tend to get a little bit worse as you get a little bit older. And people that are nearsighted tend to get them a little bit sooner because their eye is a little bit longer and more stretched out, and that jelly tends to break down a little bit faster. And the last thing I'll say about them is that most of the time they're harmless, but sometimes they can be something serious. So if you see flashing lights and then you see a floater, or the floater appears really big, it's taking up part of your vision, or if it even looks like a curtain that's kind of floating in front of your eye, that could be a sign of something going on, like a retinal detachment, and that would be something that we'd be pretty concerned about. So if you see anything like that, give me a call right away and let me know. Otherwise, the typical everyday floaters, they're definitely worth looking at to make sure they're not anything serious, but most of the time they're not. You kind of just have to learn how to ignore them, which is pretty hard to do sometimes. Anyways, hope this helps you out, and thanks for watching.